Louisville's crisis call deflection program has doubled in activity since expanding its hours this summer. The nearly 2-year-old program sends mental health workers on calls instead of police. Focus reporter Travis Breeze shows us how many people are actually being connected to services as part of the program.
Hello, this is Imani with Deflection. How can I help you today?
The crisis call diversion program is sometimes called deflection.
We are able to keep more officers on the streets where they can do their police work and not deal with runs that they're not really qualified to handle.
All calls come in here to MetroSafe. If the original call taker senses a mental health crisis without an immediate threat, it gets transferred to the crisis triage workers.
Spend a little bit more time learning about what the situation entails.
Nicole Wiseman manages 7 county services part of the program, while James Polk handles the MetroSafe side. 60% of crises are handled over the phone. If someone needs in-person assistance, they send out the mobile response team. 2 workers from 7 counties meet people with an unmarked van and de-escalate the situation while finding out what they really need.
What is it that you are hoping that will be the biggest change, that you're looking for? Is it something where you need that higher level of care, where you need to go to the hospital? Or is it that we could actually take you to another community resource?
This is police responding to a low-level trespassing call 2 months before the deflection team started. The subject, 66-year-old Keith Smith, had 21 misdemeanor arrests in 21 months before dying in custody. The Department of Justice used Keith as an example of why LMPD needed a crisis calls diversion program in its scathing March report. Wiseman and Polk both declined to directly address Keith's case. But generally, they said calls like this still require police involvement at first.
Police go out and at least clear for safety, but if they're there and they're able to say this is actually something that's going to be more appropriate for deflection, then that's something that they can send to us pretty quickly.
71% of people who got a mobile run voluntarily agreed to be taken to a service provider, hospital, someone's house, or a homeless shelter. That's 412 people in the last 9 months.
What we do is we break that cycle by showing them there's a whole avenue of things that we can provide you. All you have to do is let us.
They'll continue to do outreach so police officers on the streets and service providers remember they are just a call away.
The more the officers get comfortable with using us, and as time goes on, and then as we expand the hours, I expect we'll at least double again.
When you call 911, you can immediately ask to be transferred to the deflection team between 10 a.m. and 10 p.m. The program has 32 employees right now and almost $3 million in the most recent city budget. They are trying to expand to 24-hour service soon. In Louisville, Travis Breeze, WHAS 11 on your side.
This year, the mayor expanded the call diversion program to all 8 LMPD divisions. The move laid out in recommendation number 19 in the Department of Justice's report on LMPD.